Have you ever felt persistently sad, anxious, helplessness, guilt, or empty inside? Have you ever been extremely tired or lose interest in your favorite hobbies or activities? If yes, you may be in a state of depression and anxiety. Many are in denial and don't want to admit that they have these symptoms, but this is a very serious mental disorder. It's more and more common due to high stress, loss of job, or loss of a family member. A traumatic event could also happen in somebody's life that can cause this mental disorder. I personally have experienced a traumatic event in my life. I have been dealing with depression and anxiety for over a decade. But in 2008, it got much worse. I was assaulted in my home. My husband had injured himself and couldn't work, and I was not in a state of mind to be able to work either. We lost our home, our jobs, our stability. Our kids had to move from house to house because we could not stay in one place. So what is the difference between anxiety and depression? With anxiety, there are more than 3 million cases per year. It can interfere with your daily life. Some of the things you may feel are a state of panic, sweating, palpitations, chest pain, a choking feeling, overwhelmed or faint-like. I have felt all of these before. Many are normal to feel this way. Before taking a big test or making a big decision or dealing with a problem, we all feel anxiety. But when it lasts for more than a long period of time, then it can be considered this mental disorder of anxiety. With depression, there are also over 3 million cases per year. It is a mood disorder that can last a long time. To be diagnosed, you have to have the symptoms for more than 2 weeks. Some of those can be a loss of interest or pleasure in hobbies and activities, decreased energy or fatigue, restless, difficulty concentrating or remembering things. It can even be death or suicide. You may have some or just a few of these symptoms, but they all are very serious. Some days it can be hard to want to do anything or function when you have depression. Anxiety can be linked to depression. Psychologically, it can be hard to concentrate, you're always anticipating the worst, you're irritable, restlessness, and you have a low self-esteem. Some of the physical are change in appetite, whether weight gain or weight loss, muscle aches and pains, loss of energy, changes to your menstrual cycle, and hard to sleep. So how can you be treated if you have this mental disorder? There are medications. There are not medications for everybody, and there are many different kinds. Sometimes you have to try them out for a few months to kind of get your system used to it. Medications don't get rid of the disorder. They just simply help you get through each day. Sometimes getting off the medications can be just as hard, and the side effects can be just as worse. I have tried to do this before because I felt fine, but I was more irritable and I could not concentrate. It was worse than the symptoms of this disorder. If you ever feel the symptoms or signs, or if you know anybody who shows these symptoms or signs, talk to somebody. Don't judge others. You don't know what is happening in their life. You can overcome this disorder. Don't be ashamed. Talk to somebody. Everybody has gone through this. Some just don't know it. Don't be ashamed to know that you have this mental disorder. I don't know if I'll ever get rid of it, but I have learned how to deal with it. It doesn't matter how big or small your symptoms are or the problem that's causing these symptoms. It does not matter. Big or small, it's still very serious and you should talk to somebody.